every day I was grieving something I couldn't do anymore. I could not even stand up long enough to fry an egg. I was taught that everything that was ever wrong with me was because of my weight. I've had an eating disorder since I was 5. Before I started carnivore, I dislocated or subluxed something at least 3 or 4 times a day. I could be wearing a flip-flop, slide my shoe off and put my shoe on the ground and break a bone. There's a lot of gaslighting. There's a lot of, you're too young for that. You don't look like you feel that bad. It's all in your head. It's just, you're anxious. I had 3 or 4 doctor's appointments a day, every day of the week. There's no treatment. There's no cure. Well, I hope that I changed the history of that statement. You are not the same person that I saw last time. You are a completely different person. What are you doing? Carnivore.
Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly. All right, everybody. Well, welcome. Today we have with us Amy, who is going to share what I think will be quite an interesting success story. So, Amy, if you don't mind, maybe to start, tell us a little about yourself, who you are, and we can get going from there.
All right. So, hi, everybody. I live in Fort Worth, Texas. I grew up in Texas, and I have been on carnivore since January 20th, 2024. And so a year and just 2 or 3 months. I started carnivore because I wanted to get healthier, and I did not do it for weight loss. I knew that as I did carnivore that my weight would follow doing whatever it needs to do. And sometimes that can be a little bit discouraging because, of course, I want it to be faster. But at the same time, I'm happy that it's going as it is because where I started, Dr. Baker, I could not even stand up long enough to fry an egg. I had to use a wheelchair for the past 5 or 6 years everywhere I went because I couldn't stand up long enough to go places. I did not use it in my home, mainly because every time I loaded it in my vehicle and took it out of my vehicle, I injured myself. So it was, kind of, do I injure myself in the house or do I injure myself all the time? So I took the half of it and, only injured when I was going places. And why do I injure myself so much? So I'm sorry if you hear the jets. I live by a naval air base and the fighter jets are always flying over. So pardon that I don't know how loud it might be. Anyway, I have a couple of rare genetic disorders, and combined together, I think makes them a little more rare. And I can't wait to hear what you think about my theory that they're not as rare to have together, just not recognized together as much. But anyway, we'll get there. So the number one thing that I have learned on carnivore, I'll just start with that, is that consistency is what builds success. It's not perfection. Consistency gives you, even in your mistakes, you're consistent in learning every single day if you're following carnivore. Carnivore taught me to see food as nourishment rather than a source of guilt or shame. I was heavy my entire life, still very heavy, still probably need to lose about 100 pounds. I've lost somewhere in the neighborhood between 70 and 75 pounds so far. But I was taught that everything that was ever wrong with me was because of my weight. I was heavy as a child, and so I would eat to punish myself because I knew it would make things worse according to the messages I had been given. So I stopped punishing myself for eating. With carnivore, I've learned that I can now start celebrating the progress I'm making physically and emotionally. I've had an eating disorder since I was 5, different kinds of eating disorders. I say disorders because I've pretty much covered the gamut. And carnivore also helps with eating disorders, by the way. Mm-hmm. So anyway, I am an author. I write children's books for carnivore. I write children's books for other reasons, but I have a co-author, and she and I have total 5 books on the market for carnivore kids. teaching them about the goodness of carnivore and the horrible things of all of the things that we eat before carnivore. I'm a missionary and I'm a photographer, and I am still in progress. I label myself as BC and AD, before carnivore, and Amy during carnivore. So right now I'm smack dab in the middle. And so I want to talk to you about the genetic disorders. Is that okay with you to start with that?
Absolutely, for sure. And just the commentary you'd mentioned, eating disorders and how carnivore helps with that. And I've absolutely seen that over and over again, whether it's anorexia to binge eating disorder to bulimia. So for sure. So absolutely. I've seen that many, many times. So go ahead and share with us your interesting genetic, background, because a lot of people, some of them have heard of some of them, but a lot of these people have never heard of, I'm sure.
Yes, and some of them who have never heard of it may actually find themselves with the same symptoms. So, that often happens with this. So I have Ehlers Danlos syndrome, and it is a connective tissue disorder. And connective tissue is like your glue that holds your body together. And if you think about a house made of sticks that you would have made in elementary school with the glue, and the glue that you put on there dries up, or it's faulty, it wasn't very sticky to begin with, what happens to your stick house? It just falls apart. And that's what the connective tissue does for your body. And connective tissue that affects my body, it's the collagen. I don't make good collagen. I make collagen, but my collagen, there's a protein that does not cross over into building the collagen that you need to hold your body together. And that it's a genetic mutation. There are, Dr. Baker, I'm sure you probably can tell me, I think the last count I knew was around 18, maybe different subtypes of EDS. Maybe there's more. I don't know.
Yeah, I'm not, the numbers, and they continually change and they keep adding. And so there's probably, what we don't know is probably as many more types than what we know so far. So yeah.
Yes, true. So I have classical type, which I don't really pay attention to the numbers. I think it's type 1. That might be type 2. But anyway, it's more of a rare form. A lot of people can be hypermobile. I think about the people at Cirque du Soleil that, do all this bendy stuff. Majority of them probably have Ehlers-Danlos syndrome and don't realize the damage they're doing to their bodies. But anyway, not making good collagen is what happens with me. So that means that I dislocate and sublux joints. And the subluxation is a joint that comes halfway out of place, or maybe not a complete dislocation. And before I started carnivore, I dislocated or subluxed something at least 3 or 4 times a day, numerous times throughout the day. Now, during carnivore, I sublux maybe 2 or 3 times a week. I even have some weeks where I don't dislocate anything or sublux anything anymore. I'm not doing anything different. I haven't been exercising, strengthening muscles, anything on my own other than eating carnivore. EDS is progressive. There's no treatment. There's no cure. Well, I hope that I change the history of that statement, because I think my EDS is reversing. And I think it's like when I was a kid, I was very flexible. I was always a kid that was double jointed, but it didn't hurt me as much when I was a kid. As you get older with EDS, your muscles get tighter because they're so busy trying to hold your joints together. So it's very easy to tear your muscles by doing practically nothing. I tear ligaments and tendons often, or I should say I did. And so, I think if I really believe that if I would have started as a child eating carnivore, I didn't know I had EDS, by the way, until my mid-40s, which is also common for a diagnosis age. But if I would have known as a child, I think that I would have never gotten as bad as I am with my EDS. It wouldn't have progressed to the point that it is now if I would have never put those bad things into my body. That's my own personal theory. I don't know if that's true. EDS, like I said, it is progressive. It would have caused maybe some problem with something somewhere, maybe not. But the other thing about this is that EDS, I say that it's made of about, I guess it's about 80% collagen. Your body is made of about 80% collagen, ish, somewhere around there. And so it just means that collagen is in everything, right? And so that means that I call EDS the equal opportunist to mess up anything in your body because if I don't make good collagen, it can cause learning disabilities, organic depression, 100% organic depression, and just all sorts of situations in your body. I was suicidally depressed for a long, long time because every day I was grieving something I couldn't do anymore. Weekly, I would grieve things that I just couldn't do anymore. And all of those things are coming back to the point that I was thinking about it when I was making my bed today. I was like, man, this is the second week, every single day of the week that I made my bed. And I actually wanted to do it because it didn't hurt me to do it. And I thought, I'm getting a little bit of my own organizational self back that I had to let go of for a long time. So I think that it's the small things that are so exciting. But the other problem that I have is osteogenesis imperfecta.
Let me just stop you there before you go into that, because that's another interesting disease that people have not heard of probably. But with the EDS, the Ehlers Danlos syndrome, and by the way, you're not the first person I've seen on Carnivore that has put that largely into remission. It's quite amazing, and it shocks me because it's this weird genetic connective tissue disorder. I'm like, how the heck would diet fix that? But it does for whatever reason. How long, when did you start having your first dislocations? How old were you? How long did you persist in this state? And then the follow on to that is how long were you on Carnivore before you started to notice an improvement in that?
Okay, so the very first thing that we know that happened to me having EDS is that I was born with kidney reflux. A tube from my kidney to my bladder was backwards, which, by the way, is a huge marker of EDS that is a little known marker. But so I had kidney surgery when I was 3. I was dilated they dilated the urethra once a week for an entire year when I was from the age of 3 to 4. And so that set up a lot of medical trauma for me because that is a very barbaric thing. They don't even do it anymore. They put you to sleep if they're doing it now, if they do it. But I grew up with chronic kidney problems because of it. The list of things, which we don't have to go over them, but I wrote them down just in case. Excuse me, the list of things that EDS can offer your body is just ridiculous. But I had my first shoulder dislocation. I must have been about 4. And I remember that it was on a Saturday. My family was going to Six Flags. And I think my brother pushed me off of my grandmother's bed and dislocated my shoulder. So this was on a Friday night. We ran over to the pharmacist as you used to in a small town. And he helped me with it. I don't remember if I think they might have taken me to the hospital. I don't remember getting it fixed or if it just, we just popped it back in. But I do remember the pharmacist giving me some really bad tasting medicine and a Hershey bar to hide the taste. So that's why I have such a strong memory of that. But I, from a very early age, maybe I also have POTS, Postural Orthostatic Tachycardia Syndrome. It is a great thing that goes with EDS. I don't almost think you can have one. You cannot have EDS without POTS. You can have POTS without EDS, I think. But I can remember always having to sleep on 2 pillows because I would get too dizzy laying in my bed. I had so many injuries that when you have EDS, you just kind of have an injury and you go on with it. I didn't dislocate as often as a child, obviously, as I did. Probably didn't start dislocating until maybe my mid-20s. And I might have been dislocating before that and just didn't know that's what that was, possibly. But, and then, like I said, it had just gotten worse and worse. And I was on Carnivore about probably 2 weeks when I noticed the first thing that went away was my head to toe pain. just completely went away. And I still would ache. Still, I ache here and there. Maybe 2 or 3 places will hurt at one time, but it doesn't last as long. It's not as intense. And it's kind of random pain. And what I actually think that random pain is still my body healing. I'm wondering, and this is a great question for you, I'm wondering if, when I come to you as my doctor and you say, what is your pain level? And I had 3 dislocations yesterday and I say a 10, you're going to look at me and go, no, you're not. That's impossible. Like, no, it's not. It's very possible when you have EDS. But I heard something the other day about how your nerve endings can be the problem with your pain, and for the doctor misunderstanding why a person feels like their pain is worse than, what you look like it is anyway. Very straight face with EDS, you learn to hide it. But I'm wondering if it's because I also have myasthenia gravis. I don't even know if I say it correctly.
Myasthenia gravis is
Myasthenia gravis, yeah. That I don't even want to know how to say some of these things because I don't want to own them. But I noticed that was another thing that started. I thought at first it started getting worse, so it just feels like I would have within those first couple of weeks stabbing pain, like somebody had an ice pick and was sticking in my muscle and doing this with it. And I was wondering if maybe those were the nerve endings that were beginning to heal. And that took care of a lot of my pain because how your nerve endings are associated with pain and how it travels. It's just something that I just started thinking about, as a matter of fact, last week, and wondering if that's why that's kind of what's happening with your pain anyway. But probably within a month, I noticed that I had only dislocated maybe once or twice a day. And my wheelchair, I stopped using it. Let's see, I started January 20th. By the second week of March, I was able to put it into storage, and it's been there ever since. I haven't used it since March last year, which is amazing because I just couldn't. I couldn't function without it. And you know what, Dr. Baker, it's so sad. When I first got that wheelchair, I was so excited. I thought that this is freedom. I have this wheelchair. I'm free now because I could leave my house and go do things. That was not freedom. Like I said before, I injured myself every time I used it. So, yes. So probably just a very short amount of time. Within 3 months, for sure, my dislocations were very rare throughout the week compared to, and I also don't wake up with things out of joint as much anymore. I just have one joint that bothers me if I lay still too long. That's it. And that's my hip joint. And probably as I lose more weight, that'll probably get better too.
Which, just for sake of completeness, which joints are the ones that chronically dislocate for you? I'm sure your shoulders, those are the ones that everybody dislocates, but what are the ones that dislocate commonly for you?
Commonly for me, my feet, actually. I know that your feet aren't supposed to roll and bend in the middle. Mine do. And so I can often step down, just take a step, and the bones kind of roll over on each other. So, those are subluxations that are causing that.
So this is like this is a midfoot area. So maybe what we call the tarsometatarsal area, I would assume, kind of.
Just kind of all places. Yeah.
Okay.
Yeah. But mainly, like I had a Morton's neuroma on my fourth toe. It's kind of in that area. And my feet curve in, like instead of them being straight, they curve in. And so I had surgery in 2000 because when I was a kid, I was born with extra bones, another big marker of EDS. Extra metatarsals I was born with. So I had them fused when I was in about, seventh grade or so, 7th or 8th grade. And then I had to go in and have one of those removed because it had grown. And when we did that, he fixed my foot in a cast so that my foot would be straight. And so now my right leg, I wear a size 11 shoe. On the other foot, it's a 10. That's made a size difference. Buying shoes isn't always fun now. But yeah, so I think that wrist, fingers, definitely thumbs, pulling up my pants. I dislocate a thumb still. It's the most common. But I would do things like put my hands underneath my legs if they were cold, just to get some warmth. pulling them out would dislocate my wrist every single time. And you think I would remember, but I don't know what it is. It's just how your body is. So you don't really think about that. Could I have avoided that by maybe putting my hands in a blanket? Probably, but it just didn't run through my head at the time of seeking comfort, I guess.
And so you said within 3 months, dislocations went down to a very minimal now, from 3 to 4 a day to once or twice a week now, and that's got to feel good. I mean, it's got to be something that is like, wow, it saves me a lot of time, because I'm sure it's annoying, if not painful, to have your joints always dislocating.
It's very painful. It takes a lot of energy to hurt. It takes a lot of energy to have pain. And I have noticed that I rest better, I sleep better. My sleep is still very, very poor, but I used to sleep probably for the past 4 years before Carnivore, 2.5 to 3 hours a night, never all at the same time. I was exhausted, but it was pain that kept waking me up. I also, before I go too far, I must tell you that I have about 6 congenital heart issues that also greatly disturb my life. And it is part of my EDS diagnosis, because your heart's made of collagen. Yeah, so we can get to that part for sure.
Okay, and so the POTS, for people who don't know, postural orthostatic tachycardia syndrome, where when you change positions, your heart rate goes kind of crazy, and you might dizzy and fall down and things like that. Has that improved as well on Carnivore?
So much so. That's, what? I use my wheelchair because of POTS, not because of EDS. I could walk through any kind of pain. That wasn't the problem. It was the POTS. I couldn't stand up longer than a minute or two. And now, as a matter of fact, I was at the meetup in Yuma, Tennessee with Dr. Barry and Carrie Mann from Healing Humanity. And I was there from 11 o'clock until 8 o'clock at night. And I noticed that I probably sat down that entire time a total of about 3 hours. That is a miracle. That is a miracle. Am I tired? Yes. But has it taken me 2 weeks to recover lying in bed because I did that? No. And that's another thing that I noticed right away, being able to put my wheelchair away. I noticed that I could get up and do some things and then sit down and need to rest, but I could rest for 20 or 30 minutes and then feel like getting up and doing something else, where before, if I did something for 5 minutes, I am not kidding, I could be in bed for a week. And it's that old adage, the more you don't do, the less you feel like doing, right? So you're perpetually not able to do things. Part of it has to do, have an ASD and a PFO in my heart with some bidirectional shunting. So I can tell the difference between when there's a shunting issue and a POTS issue. I can distinctly tell the difference now. And so it lets me know what to do to help myself in either situation. And just the fact that I can tell the difference, that it's not all just one big ball of mess of, your life is really bad. That's helpful.
Yeah, so you got some holes in your heart that make blood flow in an abnormal direction. That puts you at increased risk for blood clots and strokes and things like that, as you probably are aware. So I want to talk about this other unique genetic condition, OI, which I think you have. Can you tell us about that a little bit? Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly.
Yeah. And I honestly don't know nearly as much about it as I do EDS. I actually found it myself, and I had seen a geneticist for my diagnosis of EDS, which, by the way, takes a geneticist or an orthopedic. Those are the two people you see to get your diagnosis for EDS. And there's the Beighton scale that you go through for EDS. I don't think there's a scale for OI. I seriously doubt it. But I found it and took my findings to the geneticist, and he wanted to know if I was a geneticist. I said, no, I just do really good research. So it's basically brittle bone disorder or brittle bone disease. It's also the kids that have spina bifida. That is a type of osteogenesis imperfecta. The type that I have is type 1, and it's progressive as you age. And correct me if I'm wrong, because I'm not 100% sure. But the type I have affects usually just your hands and your feet. And I have never broken a bone in my hand, but starting about 10 years ago, I started breaking bones in my feet. And I could just slide my shoe off. I could be wearing a flip-flop, slide my shoe off and put my shoe on the ground and break a bone. It was ridiculous. I've broken about 6 bones, mainly in my left foot. And so I actually had a really bad fall out of a van, and I broke my left ankle and my right knee. Unrelated to OI, it's because of the EDS that I broke my ankle because, I turned it so badly that it stretched the tendon so badly that it snapped the end of the bone off, right? So, but I was able to go in and get that all repaired and everything tightened up. And now, after that was 2 years ago. And so surgery, you know how it is after surgery, you're sore. And then occasionally if the weather changes or you step wrong, it's going to hurt. But I never have trouble with my ankle anymore. Either one of them, actually. My feet the only time they hurt is if I stand up for a really long time and they're just holding a lot of me up and they're not used to it. So, but I'm assuming that a lot of people with Ehlers Danlos syndrome actually have OI. And it's just not recognized as going together.
Let me ask you and you said OI type 1, and that's classically associated with blue sclera. So the whites of your eyes are actually blue or bluish. Do you have that?
Yes, I do. Yeah.
Interesting.
I could show you. I don't know how it would look if I tried to get up close enough to my camera so you can see it. I don't want to scare anybody with my eye, like, oh.
So let me ask you, so you said you self-diagnosis, but I mean, I assume you've seen physicians over the years, and if somebody presents with multiple dislocations or subluxation, it's not a hard diagnosis to make Ehlers-Danlos. I mean, that's one of the first, that's a very common presentation for this. So any competent physician would be able to say, hey, look, you've got EDS, or we think you do. And then of course you can confirm it with genetic testing. But the same thing with OI. Particularly, it often presents with kids breaking their bones, and sometimes it's confused for child abuse because these kids report with multiple broken bones. And so I'm just curious, has there been somebody that confirmed the diagnosis of OI? I mean, certainly if you have blue sclera, that's a pretty big indicator for that.
Yes, and as a matter of fact, I was diagnosed by a orthopedic with my EDS. He's the one that told me. I'd never heard about it before. Mm-hmm. And I was always complaining, oh, my elbow hurts or this hurts. And he said, how far can you bend your little finger back? And so I showed him it's part of the Beighton scale. I showed him I could go much further. Usually people can go this far, but, I can. When I was a kid, I could actually touch the back of my hand. And can you touch your thumb to your arm and stuff like that? But he said, go home and look up connective tissue disorder. And it validated everything that has ever been wrong with me my entire life.
Did you have like really elastic skin? A lot of people have very stretchy skin as well.
Yes, I do. And it's not because I've lost weight. I've not lost enough weight for that. Classical involved, it's more of a skin issue. Yeah. I also have, I don't know if you can see it, but my scars look like cigarette paper. I can't turn my hand the right way for you to see it. Anyway, it looks like cigarette paper. And so my scars start out looking like a worm and then they flatten out. Have them, with my pacemaker. Also have a pacemaker because I have complete heart block, which is not clogged arteries. It's an electrical problem. But so the OI definitely, EDS also gives you blue sclera. There are several markers with EDS. I used to work with special ed kids, and for different things that they dealt with, there are different markers, for kids to have. And I've noticed several of those in people with EDS. I think it comes from noticing them ones in the kids, right? So another one that's pretty common is that my fingerprints, my knuckle prints, they look like elephant footprints. They're round. So that's another interesting. And usually your eyes are slanted down a little bit. And then another marker is the way that you hold your pen and pencil. There's a difference. Little things. Since I've worked with kids for so long, when I found out that I had EDS, I started recognizing it in kids because of those simple little markers,
Yeah, it's, because there is, when you look at osteogenesis imperfecta, I mean, that is also a connective tissue. There's a connective tissue component to that because our bones are made of type 1 collagen in predominance. It's a significant proportion of that. And so there probably is some degree of overlap with that. So I mean, I'm just trying to, your picture, you're really can't do much outside. You can't walk, can't stand very long. You're in pain constantly. Obviously it's affected your mood. You said you felt it sometimes suicidal. I mean, quality of life was not good. I mean, and significantly overweight. All these things, you got the heart issues, you've got, the EDS, the OI, you said myasthenia as well. Now, how did you pick up a myasthenia gravis diagnosis? This is an autoimmune disorder.
Yes.
It's kind of an unusual presentation. How did it affect you?
It affects me mainly in my arms. This is how we picked up on it. So like if I were brushing my hair, I could maybe do 3 or 4 strokes and my arms felt like I had been working out for 6 hours a day for a week. And then I stopped brushing my hair and would notice, after a few, maybe 30 minutes, I could do a few more strokes, before it started hurting again really bad, just severe pain. And it affected me mainly in my arms and shoulders. And I'm having no trouble with my muscles at all right now. I do occasionally have a nerve ending that gets really, painful, like I said before. But now I look at it because I understand what's happening, that it's like after you've had surgery and those nerve endings start healing. It's a resemblance of that right after surgery, a couple of days or a week or so after. And so I celebrate that pain because I know that's something else that's healing. Another thing with Ehlers Danlos syndrome, I have lipidemia. 50% of the women with this have connective tissue disorder. I also have mast cell activation disorder. So mast cell, POTS, EDS, it's kind of the trifecta. They kind of go together. I also have dysautonomia. I have rheumatoid arthritis. The list goes on and on. I have another one I can't pronounce, the ankylosing spondylitis.
Yeah, you actually said it right, ankylosing spondylitis. Yeah.
I'm so proud of myself. Yeah, possibly in L5 and L6. Those vertebrae are fused together. I'm pretty talented. I can fuse my own bones. Degenerative disc disease, fibromyalgia, it's like I said, if I lived on a planet, well, maybe I didn't even tell you this. If I lived on a planet where everybody had EDS, I would be completely the normal patient. But since I don't, when I go to the doctor, there's a lot of gaslighting. There's a lot of, you're too young for that. You don't look like you feel that bad. It's all in your head. It's just, you're anxious, and it's been tough. It's been tough to get a diagnosis and to be believed. And, but I have other challenges with carnivore besides EDS. Had gastric bypass surgery. Well, it's not super easy to eat carnivore. It's very, very possible, but it's not super easy to eat carnivore with gastric bypass surgery. I also have hemochromatosis. Well, that's another thing. I can't have too much iron. So there are things I'm adaptable. Thank goodness to EDS. I think it's a superpower it gave me to be adaptable and to think outside of the box. So there are certain things I do that help me with that, which are not huge things at all. But carnivore is the easiest thing I've ever done, Dr. Baker. Easier. If it would have been any harder, I probably wouldn't have been able to survive the getting through the first, I would say, less than a week to feel better. I started feeling better immediately. And I don't know exactly what it was. I think it was I can remember the day probably about 2 or 3 weeks in. It felt like the blinds were here and they had been opened up. And I was like, oh, hello, world. My brain was clear. My brain fog went away. The proof is that I can say brain fog and not brain frog. Uh, so just so many things are different, and I want to be more physical, more active, because I think that now I can strengthen my muscles without the pain and the agony and the dislocations and the subluxations. And being able to strengthen those will even increase the amount that I don't dislocate, right? So my last thing is getting these holes in my heart fixed. I have an appointment in Mayo in Phoenix in June to go talk about my second appointment there, to talk about surgery to close these up. And I feel like that's the last thing that's keeping me from taking that next step into being active. I don't know how much activity you need to do on carnivore for the average person to, I hear you don't need to work out because it builds your muscles anyway, but, I still have a lot of weight to get off. So being more active surely would help. I think everything, emotionally too.
Yeah, I mean, activity is definitely going to be helpful. Being sedentary is not good for any aspect of our health, and I would push back on saying that carnivore is going to automatically put on significant muscle. You might put a little bit on, but you're not going to put on a ton of muscle just by eating meat. I mean, you got to put that muscle to work, and so. But as you get more and more active, and just walking at this point, just walking around is going to help build leg muscles and postural muscles and things of that nature, which will clearly benefit you. As far as the heart surgery, I can't speak to that. I mean, as far as, because PFO, patent foraminal valley is, a little, typically a small one. And then ASDs, atrial septal defects can be relatively bigger or larger depending on if you got multiple holes, So that's, I mean, it just sounds like you were just a total mess. I mean, if you came into my office as a physician, I'd be like, I ain't got time for, I mean, I'm just saying, because if you present with all these problems, ankylosing spondylitis, myasthenia gravis, hemochromatosis, Ehlers Danlos, osteogenesis imperfecta, cardiac conditions, the mental health stuff, the obesity, all that stuff. That's a lot to deal with. I mean, my goodness. And then how many medications have they put you on over the years? I'm just curious about that.
Well, that's a really good question. And by the way, that's probably less than half of my list of what's wrong with me, by the way. And I've also learned, tip to people going to the doctor who have chronic illness, only talk to that doctor about what that doctor treats. If I came to your office, you don't need to know all my other stuff. You need to know my bone and joint issues, right? I mean,
well, you need to know what medicines you're on, and some, because I mean, I just from playing the other side of the fence, it's important to know, because some things affect other things. Like if you fail to tell somebody about a heart condition and they're like, hey, let's bring you to surgery, then you're like, wait, well, maybe she's not appropriate for that surgery. So it's kind of important depending on what's going on. So I mean, but I get it. I mean, when it's a time crunch and it's just like, hey, I need a, then it gets lengthy, because it would take you half an hour just to get your history, and if you only got a 15-minute visit, it's like, oh man, it's going to be tough.
Yeah, I mean, I know that if I were first time seeing you, I would come in and tell you my orthopedic issues and not. And then if surgery were a case, then I would have to reveal this and this and this. So medicines, because of POTS and mast cell, I didn't do well with medicines. During a phase from 2000 until, probably 2014 or 15, multiple times in the hospital, psychiatric hospital, because they would give me an SSRI. I would do great on it for 6 months, and then I would break out in hives, or it would stop working. And so they would put me on another one, and I would have to go in the hospital while they switch it. As far as other things, I have not taken any medication, zero, for the past probably 4 years, simply because I do so poorly on it. I also have the stupid MTHFR gene, or
of course you do.
Of course I do, which I also think is like a given if you have EDS, by the way. More and more people I'm running to have it. But so I just don't metabolize things correct way, right? So, and I look at all of these things and I thought, how am I going to do this? How am I going to set myself up? I had a friend at my church tell me about carnivore. She was like, Amy, I really think it will help you feel better, at least some better. I think it'll really help you. So, okay, I'll try. She told me to go look up Dr. Berry, and Dr. Berry says, do 90 days. So I thought, okay, I'll do this for 90 days. That 90 days is going to pass by whether I do something or not. If I hate it, if I'm no better, I never have to do this again in my life. If I am better, I can look and see if I want to continue doing it, how much better I am, so forth. So I actually wrote a book about strategic goal planning and my journaling process and how to change your mindset and so forth. And that has been the number one thing that has gotten me through. Number two is that community, like your community, all the different carnivore communities and meeting people is so important to keep you on track and to keep you going. Writing the children's books also is a great motivator. It would be hard to teach the kids about something I'm not doing.
So. Let me ask you, now you've been on Carnivore for a little over a year now, year and 4 months or something like that. What things did it significantly help? Because you've listed, you've got all these medical issues, multiple dozens perhaps. What are the biggest things that you've noticed? Obviously, you talked about your EDS. You don't dislocate as much. The pain's gone. What are the other things you've seen a benefit with?
I think that really and truly EDS is the thing that made my life the worst, which caused the depression, which caused the brain fog, which caused, so many things. But number one is the depression, because I was so depressed. Dr. Baker, I can't even tell you. And every time I went to the doctor, it was traumatizing because of that experience when I was a little girl. I ended up with dissociative identity disorder from medical trauma, also a rare thing. But I noticed probably about 6 months in that I was handling every situation in my life. I was handling better because all of a sudden I could logically think through the steps I needed to do to make something happen. Because when you're chronically ill like I am, if I want to get that blanket that's over there because I'm a little chilly, oh, well, that's a big chore for me. I've got to move my computer out of my lap. I have to stand up. That was a problem. Then I had to go get the blanket, but I probably had piled something on top of it that I couldn't put away before. And it was just everything. Now I'm happy if there are things on top of it because that gives me an opportunity to move more. So that my attitude, my mindset got better. My depression got better. The pain was probably the number two thing that is better is my pain, which has a lot to do with your mindset, by the way. And that patients with EDS, they have a very high pain tolerance. I walked around on dislocated bone joints, broken bones, and never even knew that they were that way because and I would push it so far that I would injure myself more drastically because of it. Probably also just the passion that I have in my life for photography and for missions. It came back. I was hopeless. I thought, this is it. My parents have passed away. I'm not married. I don't have any children. I have zero support around me. I see a counselor. She supports me. But outside of that, nobody's coming to my house to help me do anything. And now I don't need them to. I'm able to do the things. And I'm also confident enough with myself that I could ask for help when I need it. So I don't know if it's the physical. I don't know what's greater, honestly, the physical or the emotional, mental part of it, because one drove the other and the other drove the other, if you know what I mean.
Do you mind, how old are you, if you don't mind sharing that?
I'm 58.
So you're my age. We're the same age. So we're both 58. So you went basically 57 years of your life with really not much in the way of getting actual help, isn't it? Isn't that, do you find that, kind of unusual? I would imagine it's got to be good to feel finally you've done something that's actually seems to be making a huge difference for you. But I can imagine you look back on that and said, gosh, I all these years it cost me. Is that a fair thought?
Yes, that's what my depression was, because honestly, I was down to using my wheelchair to go to church. And by the way, I went to First Baptist Dallas, and that is a gigantic campus down there. So it was difficult to do that, but I would go there and I would come home and have to recover for the week and feel better just about time to get ready to go back to church. I did nothing. I went nowhere. I had stopped doing photography, which, by the way, I had to take all of my pictures from inside of my vehicle because I didn't have the stamina, and I injured myself every time I got in and out of my car to take a picture. So my attitude has always been, though I have a good attitude, I have a good sense of humor. So I always thought I'll be famous for the only person that takes all their pictures inside of their car, from the car window. But now I'm also getting out of my car to go take the pictures of things that I want to. And that's exciting. But all of those years going to the doctor, being told, well, if you just lose weight, Amy, just lose weight, everything will be better. Emotionally, too, oh my gosh, the old ladies at church on the back row, all the grandmas, very well meaning, but my entire life I heard, oh, Amy, you're so pretty. You would be so much more pretty if you would just lose weight. Really? Thanks. I needed that confirmation. Thank you for telling me how ugly I am. And the doctors, you're crazy or it's anxiety, just completely ignored them. And you said any competent doctor, all of my doctors are very competent in what they know, but what they don't know, it's almost like, I don't know if they think they don't have time to learn it or they're offended because you might know something more than your doctor does. It's been very interesting. It's been very interesting. And now every doctor that I've gone to, and there at one point, I think I saw like 24 doctors. There was probably 2 or 3 years where I had, this is no joke, I had 3 or 4 doctor's appointments a day, every day of the week. I had to do saline IVs for my POTS for 6 years, 3 days a week, sitting in an infusion room. Took up so much time, and how long does it take to make a carnivore meal? Oh, I don't know. Maybe for me, probably 10 minutes is the most. It could have saved me a lot of time. Carnivore could have way back then. A lot of sitting in doctor's offices time.
So have you, since going carnivore, I assume you're still going to see some of these physicians, and if so, have you shared what you're doing? And because you've had success, you're obviously much improved.
Yes, they are shocked. So I just saw my primary, who I've seen since 2008, and he saw me go through a lot of stuff. And mainly what he does is just point me who to go see for what. He doesn't really do much. But I thought it was really funny because gone in, I'd lost 70 pounds since the last time he had seen me, was not using my wheelchair. I'm sure that I had it at my appointment the last time I saw him. Was able, my blood pressure, everything has always been low. So it's not a matter of high blood pressure, those kind of things. That's not what they're saying. The first thing, every one of them, orthopedic, heart doctor, another heart doctor specialist, this guy, and maybe 1 or 2 more that I have seen, the very first things they say to me, oh my gosh, you look like a completely different person. Your face is so bright. Your eyes are so bright. Your countenance is so much different. And the tone in your voice, you are not the same person that I saw last time. You are a completely different person. What are you doing? Carnivore. Really? I knew half of them. I knew it was the sugar. I've been telling people for a long time, get off the sugar. And then my primary was like, do you promise me you're not taking any weight loss drugs? I said, promise, I'm not taking any weight loss drugs. This is all beef, bacon, butter, and eggs. That's all I ate. I thought he was going to pass out for a minute because he was shocked.
So did any of them sort of try to dissuade you from doing that and say, oh, no, you shouldn't do it, it's not safe for you, or something along those lines?
No, and I've noticed so many people, their doctors say, well, you need to be on a statin, whatever. Maybe because my blood pressure is always low. So a doctor could not tell me to take a statin because my blood pressure wouldn't even qualify. But my heart conditions are not from blockage. My arteries are clear as a bell. It's electrical and genetic problems that are the issues with that. But they're all of them are keep doing what you're doing. I don't know what it is. Exact words from at least 4 of them. I don't know exactly what this is that you're doing, but keep doing it because it's working for you. Don't stop. So I might be standout on that with most people.
Yeah, I'm just to clarify. Certainly high blood pressure contributes to heart disease, and it might steer someone to push somebody on a statin as a secondary factor. But primarily, they're mostly concerned about cholesterol being high. So have you had high cholesterol with this or no? Or do you know?
No, I haven't on any blood tests yet, and I never have
Yeah.
actually.
Okay. Okay. That
Yeah.
makes sense. And, honestly, based on what we seem to know about how this probably, maybe if you lose quite a bit more weight, you might see your cholesterol creep up based on some of the physiology we think is going on there. And then they might get on you a little bit more about that at that point. But, wow, it sounds like this has been completely life changing for you. Where do you see yourself going? I mean, you obviously at one point very depressed, stuck in a wheelchair, can't do much. Now the world is opening back up to you. Where do you see yourself going, and what are you trying to accomplish over the next year or two?
So, being called as a missionary, I grew up doing missions work in Mexico. I served as a missionary in Fort Worth. It's a great deal. I got my apartment free for doing missions work at the complex. I've served in Nigeria, and I've wanted to be a missionary since I was 9 years old. And I am getting ready to go back on the mission field. I'm probably going to be selling my home pretty soon. And at this point, I'll live in a van and go do some missions. There is a possibility I'll be going back to Nigeria. I don't know how long. I guess is they want me to come back as soon as they can raise the money. That's how I'll know that God's ready for me to go back.
How are you? I'm just curious how living in a van or living in Nigeria. Are you concerned about being able to stay adherent to the diet, the carnivore diet, in that sort of situation?
No, not at all. Because in Nigeria, they don't have food like we do here. They don't have processed foods unless you literally go to the American grocery store. So, no, they eat a lot of beef and chicken and goats and all kinds of things. But I'm not concerned about that at all. They No sugar around. As a matter of fact, Dr. Baker, one time I went to a birthday party while I was there, and they were like, "Oh, Amy, you're going to love this cake. It's great. It's so sweet. We can hardly stand it." I took one bite, and it tasted like a spoonful of dirt. I mean, there was zero sugar. So that would be actually easy for me anyway. Maybe since I've lived there and I know what I'm in for. Living in the van, it's easy. I lived in the van for a month in Phoenix last December and January and had no issues. I took my little Coleman stove and I have a plug-in refrigerator. It's a refrigerator freezer. So I just ate like I do here at home. I don't even have a refrigerator home because it stopped working. So I've been using a little cooler for a year. Little plug-in cooler, pretty easy.
Interesting. You said you wrote some children's books about carnivore. What's the title of one of them?
So I have actually two that I can show. I've got several, but the first one we wrote was Superhuman Power Foods for Humanity, and we have Power Bacon, Power Butter, Power Egg, and Power Beef. And it is a comic book, and it takes kids on a field trip to show them how the sad American diet, the standard American diet, is bad for you. And so it's got coloring pages in it, comic book story, coloring pages, place to write your own recipes, activities for kids, a place to make your own comics in the back. And a portion of this book, as a matter of fact, goes to Healing Humanity movie. The proceeds to that, part of the proceeds go to that. And then part of the proceeds of this book, Sugar Cubie, the Sugar Monster, goes to the American Diabetes Society. And Bonnie and Beckett Berry are in the book with Granny Berry, and they come home from school and they go visit Granny Berry, and she goes, "Why are you so grumpy?" "We don't know, but look at all this candy we got." And so she goes, "I've been trying to tell you, you won't listen." So the superhuman power food characters come to Granny Berry's house and teach the kids. And so these are just two. We had one for Christmas. Santa became a carnivore and taught the elves how to eat carnivore, and they're better elf workers. We have one we just put out for Easter. We had one for Valentine's Day, how to do sweet things for people rather than giving them treats. And then I just wrote 2 chapter books, one for younger kids and one for probably 9 to 13, and then one from like 7 to 9 on carnivore chapter books and these kids go to a carnival and everybody's going crazy, so they're detectives and they figure it out. Same thing with this one; they figure out why everybody's always sugar crazy.
Wow, you've been quite industrious with all that. Goodness, yeah, that's a lot. Amy, we're about to run out of time, so I want to just share.
Sure.
Where do you have like a website or something like that you can share for people if they want? Maybe they're interested in learning more about your story, or maybe ordering a book for their grandkids or kids or something like that.
Yeah, so definitely you can find the books on Amazon. Just look up Amy Hosp. It's easy to remember my last name. It's like the abbreviation for hospital. So just think I don't need the hospital anymore. So Amy Hosp. And then also my YouTube channel, my teeny tiny little YouTube channel is Amy Hosp, a carnivore in secret. And I've got a really great progress video that's a couple of months old now there where I not lost as much, but kind of tells my story of how much has improved so far. Yeah.
Awesome. Well, Amy, we unfortunately got to run. Thank you for doing this. I really appreciate it. I'm sure this is going to get a lot of people interested in this because you've got a lot of conditions that a lot of people have out there. So thanks so much, Amy, for doing this.
Thank you so much for having me.
All right. Bye-bye, guys. Take care. See everybody.